Okay, so we'll just do the introductions first, just because that way if people join in the next couple of minutes, we won't miss anything. But hi, everybody. Welcome back to the series that we have that's called From the Clinic to the Living Room. But as you can see from the background, I'm still in the clinic. Sometimes this happens that I don't make it home in time. So we're going to be broadcasting live from clinic to clinic. But Tara, who's our lovely guest, is actually at her living room, which is good. So tonight's topic is going to be all things diet and nutrition. And I've been really excited about this topic for a long time. I'm super excited to have someone that knows the ins and outs. Tara Mauro is a licensed master certified nutritionist from Fox Chase Cancer Center. She has her certification in oncology. She's an expert in the field of nutrition. So I'm super blessed to have her on this program tonight. So we will have, I'm sure, a ton of questions. So Tara, it's super wonderful for you to join us. Thank you so much. As medical oncologists on that side of it, a lot of times we try really hard to include the nutritionist, at least at our center at Hillman. And a lot of times that's something that's very overlooked, and patients are looking to do whatever they can to improve their care and their quality of life. Just to start off, why don't you explain to our listeners what an oncology dietitian does? Like, what is the purpose of what you do?
Absolutely. So thank you so much for having me. I'm so excited to be here today and to shed a little bit of light on nutrition. I think that it's really important that when you're going to care for cancer, especially that you have a dietitian involved in your care, because I'm certified specialist in oncology nutrition. So I had a certain amount of hours of experience working with oncology patients, and then I sat and took an exam all about different oncology nutrition related things. And I work hand in hand with patients, with caregivers, with the medical oncology team, the surgical oncology team, the radiation oncology team, and everybody else to help provide the best care for the patients, because nutrition is so imperative throughout all aspects of cancer care, whether you're just diagnosed, whether you're going through treatment, whether you're post-treatment. I think that nutrition plays a huge role in the best outcomes.
I totally agree. I think, not only dealing with side effects, nausea, diarrhea, constipation, but also really there's been a big shift, especially when we started talking about the microbiome and how that sort of relates to immunotherapy in particular. And so I think now patients are coming with, the expectation that we're going to give them a very holistic approach to their cancer, which is a wonderful thing. And I think the way that the future is going to push, and really the the immune system is so tightly linked with, being well hydrated and keeping a good diet that I think you're going to be in high demand here in the next couple of decades for sure. Whenever you're looking at, the picture overall, how does diet play into treatment? Like, are we looking for people to come in with a certain diet already in place, or?
So that's a great question, and not necessarily. As a dietitian, I like to meet the patient where they are. So maybe you've never met with a dietitian, and that's most people actually. Um, but what's really most important in terms of food and nutrition going into any type of cancer treatment program is that you are adequately nourished. So we want to see you maintain your weight during treatment. We want to maintain your muscle mass and your lean body mass so that your healthy cells can fight and get you through the treatment, and that, at the end of all of this, um, you're just in the best place as possible. I think that nutrition will help to keep your healthy cells healthy so that the cancer treatment can help get rid of the cancer.
Yeah, I think that's an important thing to point out, that, there are some folks, especially that are reading about elimination diet, like sugar elimination diets and things. There are tons of, misconceptions out there about how, or at least I assume that that's a misconception, you would be able to tell us, that doing a sugar elimination diet is really helpful in treatment. And it doesn't seem like it would be given that rationale.
Right. So that's like a question that I get almost every day, if not multiple times a day, that, oh, my mom's friend told me that sugar feeds cancer, so I can't have any sugar at all in my diet. And it's really just not true. There's not science to back up that sugar preferentially feeds cancer cells. Our bodies run on the breakdown product of sugar called glucose, and our brains need a certain amount of it every single day. So if our brains aren't functioning, our body is not functioning well. So while yes, it's a good idea to limit added sugars, things like sugar sweetened beverages and pastries and baked goods, it's a good idea to cut back on those to limit our added sugars. But by all means, eliminating all sources of sugar eliminates a lot of foods, things like
Mhm.
fruit, whole grains, things that are really important to help maintain your adequate nutrition.
Exactly. And we'll talk a little bit more if you are willing to talk a little bit about the microbiome and sort of that. We've got already some questions about that in our queue. So what core nutrients, I think you've already touched on it, do patients really need? Like whenever they're looking at their diet as a whole, what would you recommend that patients include in their everyday diet?
Absolutely. So my favorite food group as an oncology dietitian is protein. Protein is most important for maintaining our muscle mass and our strength. So I try to encourage patients to include a protein source each time that they're eating. And that goes along with getting vitamins and minerals from food sources. So vegetables and fruits when we can. And of course, while we're going through treatment, there might be different side effects that are limiting our ability to eat things like lots of raw and fresh fruits and vegetables. So I think it's most important that we prioritize the protein intake
Mhm.
just to help maintain our lean body mass throughout treatment.
Okay. So when you look at like somebody who may have trouble eating throughout the course of their treatment due to nausea or whatever the case may be, would you encourage these folks to do supplements in terms of like obviously protein supplements because that's easy and helpful and easy to get down. I get a lot of questions about like, should I be supplementing my diet with herbs and other pill forms of certain nutrients? How would you speak to that question?
That's another great question, something that I get asked a lot. And the American Institute for Cancer Research actually recommends against supplementing. So, unless you have a known deficiency, it's not recommended that you take any type of pill or powder forms of other vitamins, minerals, and herbs. And not only is it a recommendation from the American Institute for Cancer Research, but a lot of these supplements are not regulated by the FDA, so we don't know what's in them per se. There could be other things that are not listed on the label, and some of these things can interact with your treatment and with your therapies. So I always encourage patients to just be open and honest about what they are already taking.
Mhm.
Sometimes patients come to me with a list of many supplements, and some of them are not recommended at all during treatment.
Sure. I think the biggest supplement that I get questioned about is vitamin D. I should be taking vitamin D because I wear sunscreen and I don't go in the sun. So, what, and I always try to explain to patients like, well, if you don't have a vitamin D deficiency, you don't need to take vitamin D necessarily. Um, it's tough, especially I feel like in nutrition. I'm sure that you encounter this because there's so many websites about this that aren't necessarily peer reviewed. And so patients get a lot of information from a lot of places that not only is not specific to melanoma, but even just necessarily cancer in general. And so, I think that that's a good rule of thumb for patients to kind of keep in mind that if you don't have a deficiency, you don't need to supplement it. And from a medical oncology standpoint, we certainly will be checking for those deficiencies throughout treatment, that we wouldn't need to preemptively do it. When you are in the clinic and you're, called, do they like at the institution that you work for Fox Chase, do you guys get nutrition involved from the very start? Or is it something that, do you think that there's a benefit from working with a dietitian from the beginning of treatment? Or do you,
So I definitely think it would be beneficial if a dietitian could meet with every oncology patient at the time of diagnosis. That's not always feasible because of the staffing issue of
We need
dietitians.
to clone you.
Um, we're often kind of called in when things are going badly.
Sure.
Patients aren't able to eat, they're losing weight. So if we could meet with a patient beforehand and kind of review, hey, these are some side effects that might limit your ability to eat, and this is what your body needs to get you through this treatment, I think we would be in a better place.
Sure. Now, one of our questions that we already have on the Q&A kind of ties into what I just asked. They wanted to know, how do you get certified with an oncology specialty as a nutritionist, but also how do you find someone who is an oncology specialized nutritionist?
So great question. So I've been a dietitian for over 5 years. And when I first started working, I fell in love with working with the oncology population, and I really wanted to learn more. It's not a lot of information that you get when you first are a dietitian about
Mhm.
oncology. So I spent 1,200 hours working with oncology patients, and then I was able to sit for an exam, and I had to pass the exam. And to maintain the certification, I do have to retake the exam every 5 years
Oh,
because
cool.
how everything's changing
Yeah.
with oncology.
That's exactly the same for PAs. We have to recertify all the time. It's now 10 years, but it used to be 5. So that, yeah, you're constantly learning. It's a good thing.
And if you're looking to find an oncology dietitian in your area, there is a website, and it's for the American Academy of Nutrition and Dietetics. The website is eatright, EATRIGHT.org. And on that website, you can find an expert. There's like a button to find an expert, and you can search and filter by specialty. So you can look for an oncology dietitian in your area.
Oh, that's awesome.
And if patients are getting their treatment at a cancer center, there's most likely a dietitian there. You just don't know about them.
Yeah, that's really good. I can post that website, link it later
Yeah.
on our Facebook page because I think that would be super, super helpful. Do you so what things are you a big proponent of? I know you said protein. What other things in terms of when you're thinking about food and cancer in general, what things do people have to be vegan? Is that something that is necessary in order to get good outcomes?
So that's a great question. My biggest proponent, I like to say food first.
Yeah.
And so getting all of our nutrients from food first, getting protein in whenever you can. And while there is research that suggests that following more of a plant-based diet is beneficial for cancer survivors and for cancer prevention, following a plant-based diet doesn't necessarily mean that you're vegetarian or even vegan. Plant-based, it just means including more plant-based foods, so including more things like fruits and vegetables. But I don't think that any cancer patient has to be on a vegan diet. I don't think that you have to be on a vegetarian diet. I don't think that you have to be on a keto diet. I'd prefer if you were just eating. I don't
Sure.
think you have to be on a diet.
Like a diverse diet that does not include, McDonald's and fast food and frozen
Yeah.
pizzas and things like that. We've been trying really hard, especially because with the emergence of the microbiome and how it, your immune system is so heavily housed in your gut, and keeping gut health is one of the forefronts in how we approach patients. There has been this, lean towards more of a plant-based diet. And I try to tell my patients, look, you're not going to wake up one day and become a vegan if you've been eating meat your entire life. And, I hope that you can continue to eat meat through your treatment. Just try to do more. We've been when trying to set goals with patients of eat 10 different fruits and vegetables a day if you can. That's a high goal. If you can do that a week, great. So I mean, kind of baby steps towards those kinds of things.
And there's a lot of trendy things like if you're trying to go more plant-based and you're not already struggling with eating and you're not losing weight, I think it's a great idea. And something that you could try is like meatless Monday. So on Monday, you eat no meats, but you're still getting protein from things maybe like milk and dairy. You're still maybe eating an egg. Just other ways to try to reduce some meat intake because I think it is a good idea. And research does show that following more of a plant-based diet is beneficial, but not kind of overhauling your diet in one night, because we know that that kind of change isn't lasting.
Sure.
Um, and your GI tract will not be happy if you
No.
try to do
No.
that.
Back in the summer when I had done a segment on the microbiome, and so I committed to trying to eat a plant-based diet for a period of time while I was researching it. I felt better. I certainly had more energy and I felt better overall, less, of a lot of things, but my GI tract was angry for a couple of weeks. So I think there's a fine line between going full plant-based, especially when that's not the case. However, I do, there definitely is, and I know that you don't do a lot in the melanoma specific clinic. But there is a lot of data that's now suggesting that, at least from a melanoma standpoint, the gut bacteria and the microbiome, certainly with like increased fiber intake with whole grains and all of that, have better outcomes with immunotherapy. There have been a couple of studies now that have shown it. So I think my goal is just to have your support in saying that it doesn't have to be all or nothing. That
Absolutely, by all means, including a fruit and a vegetable. Try
yeah.
to do small steps, because they're not going to be long lasting if you try to do everything all at once.
Hmm.
Uh, so maybe it is just adding one fruit and one vegetable a day for a week,
Hmm.
and
Sure.
slowly building up to your goal of, getting in.
Now, patients will ask about like the state of fruits and vegetables. So like if you like, is eating a raw vegetable better than eating, like, say, a blended vegetable or fruit in a smoothie, or are all vegetables and fruits created equal in your eyes?
So I think that most of them are created equal. So as long as you're using the whole fruit or vegetable, if you're using it in a smoothie, or maybe you're using it in something like a soup, or
Okay.
in a stew, or if it's just the whole fruit or vegetable, it's actually fine. There's varying amounts of the micronutrients, so vitamins and minerals, depending if certain vegetables are cooked or some of them are raw. So it just depends on the particular vegetable,
Hmm.
if it's cooked or if it's raw, if the micronutrients are higher or lower. Some things are higher when they're cooked, some are higher when they're raw. But I think if you're getting the vegetable in, that's the biggest
You're
thing.
winning,
Yeah,
right?
absolutely.
We had an actual really interesting question. It says, my treatment has made me a type 1 diabetic. I have had to stop treatment, but how do I combine diabetes and cancer in my diet because of that? So,
So that's definitely tough. But what's most important in managing your diabetes and your cancer is that you're helping to manage your glucose levels through the foods that you're eating, that you're eating consistent meal times to help manage those glucose levels, and that you're balancing your carbohydrates and your proteins. And if these are not familiar terms to you, I would definitely recommend sitting down with a dietitian so that they
mhm.
can go over one-on-one your exact schedule, your exact medicine regimen, so that you're getting exactly what you need.
Yeah, that makes really, really good sense. Um, what do you think, does age play any type of role in nutrition in terms of, meeting the needs of cancer patients? That was
Mhm.
another question David had actually posted on our chat.
Yes. So, in terms of age, I mostly work with the adult population. And as we get older, we actually need more protein to help maintain our lean body mass, because we lose it as we age.
Sure.
So the elderly, like 65 and older, are going to need more protein than somebody who's like 50 or 40.
Okay. That's super helpful, and something that I think is lacking in most people's diet in general as they age, for sure.
Yeah.
Um, Lisa asks a question. I've read conflicting things about dairy and soy. Do you have any, um, can you speak to whether they are necessary and beneficial, or if it's better just to find plant-based proteins to take their place?
Another great question. So there's been a lot of buzz about dairy and cancer. I don't know that it necessarily about dairy and melanoma, but I get a lot of questions about dairy and like GYN cancers,
Hmm.
about that they're totally avoiding dairy. And I don't think that that's necessarily what you need to do. And there's no research that says that dairy is going to make cancer worse, cause cancer, anything like that. And dairy is actually a good way to get some protein, as are soy products. And I get a lot of questions about soy causing, more of like the breast cancer type of thing.
Sure.
And there's actually not sufficient evidence that links soy products in our diet to those types of cancers. So soy is actually another great way to include some plant-based protein.
Okay. And in terms of like inflammation, that doesn't seem to cause more of like an inflammatory people. One of the questions that I get quite often is like, I'm trying to avoid all things that are inflammatory in my diet. So I don't eat spicy foods and I don't eat soy and I don't eat dairy. And so, I think we should make you a t-shirt that just says include all the foods in your diet.
Definitely. So things that are higher in fat are going to be more inflammatory. So you can still incorporate dairy at choosing a lower fat dairy product.
Sure.
You're gonna be still following part of that anti-inflammatory diet, and getting in the fruits and vegetables will help as well.
It's a simple fix. Kathy wants to know about taking a probiotic while going through cancer treatment, and in particular immunotherapy.
That's a great question. It's actually not recommended to take probiotic supplements, especially if you're on immunotherapy. So again, I go back to review all of the pills that you are taking with the doctors at the first time that you meet them. And if you have questions about taking supplements, ask, because there are certain things that you shouldn't be taking, and probiotics in the supplement form is one of them, especially during immunotherapy treatment. But you can still get probiotics from food sources. So things like yogurt or even fermented products like
Kombucha.
yeah, not my favorite, but
I know I always want to like it, but I just do not.
yeah. So not taking the supplement form.
So what other things besides yogurts and things like that? So I know you said fermented things. So like sauerkraut and pickles and things like that.
Pickles, miso products, and there's a lot of the plant-based yogurts that do have the active probiotics in them too. So not just dairy product yogurts.
Okay, cool. Irene in the very, very beginning wanted to know if there are any vegan foods that are definitely good to eat. And she talks about that understanding that fermented food is good for gut microbiome. I think you kind of talked about that a little bit.
So vegan really just means no animal products, right? So vegan foods are excellent, right? We're
Sure.
thinking fruits, we're thinking vegetables, we're thinking whole grains, nuts, seeds. A whole food is good. But if you're in the grocery store, you can be very overwhelmed because you'll see a lot of things that say that they're vegan, that they're all natural. So I think that if you're looking at food labels, try to really be a detective and identify if it's a whole food, because a lot of the vegan foods in stores are very highly processed and things that we should be avoiding anyway. So
Yeah.
so sticking with the whole foods is my go-to.
So when you like talk about processed foods, is it just because we're not able to break them down? Is that the reason that avoiding processed foods is important? Because we're just not gaining as much nutrients from them, or?
So like when I think of super highly processed foods, especially like vegan foods, there's a lot of meatless, like meatballs and meatless chicken patties and all of
Sure.
those. And there's lots of fillers in them, and you're just not really getting much benefit from any of the things that are added.
Okay. So telling patients to like stick to the outside of the grocery store where you have fruits and vegetables and things that will perish. One of the things that, when we talked about these things in our clinic, we always try to say, if your food source lasts on a shelf longer than like a month, you may want to think about getting your nutrients from something different.
Yeah. And by all means, it's not to say that, frozen vegetables are still a great way to get vegetables, as long as vegetables are the only thing that's in there. We don't necessarily need to have all of the additives, all of the oils, fats, sugars, whatever else they're adding to help preserve those food items.
Okay. What about caffeine while on immunotherapy? One of our folks, Keith, had asked a question about that caffeine intake.
So I don't think that you need to limit, and I don't think that you need to drink it if you're not already a caffeine drinker. If you're running into symptoms of having any kind of diarrhea, loose, frequent stools, though, caffeine can make that worse. So cutting back on caffeine would be beneficial at that point. But if you're kind of sailing through treatment without any issues, again, caffeine's fine. No need to restrict, but you don't have to start drinking it if you're not already a drinker.
Okay. Do you have any recommendations about like hydration in terms of like goals for hydration, or is it very individualized?
So that's something that's typically very individualized based on your age and your weight, also based on what's going on with you. But if you are experiencing lots of side effects like nausea, vomiting, diarrhea, and you're losing lots of fluids,
Mhm.
one recommendation that I'll have is to have an extra 8 ounces of fluid each for each liquid bowel movement that you're having when you're having diarrhea.
Okay.
Um, but otherwise, your fluid needs are based on your age and your weight as well.
Okay. So like there's not like a magical number that, your goal every day should be 2 liters unless you have diarrhea. It's just what you need in terms of replacement.
Yeah, and I like to keep that individualized just because if I have somebody who's a petite 5 foot woman, her fluid needs are going to be very different than somebody who's maybe, you know, 6'2" and very muscular. So everybody's different. And it's important that everybody realizes that.
Yeah. Tara, we're getting some really, really good questions. So I'm sorry for bombarding you and put you on the spot, but
Yeah.
Glenda asks, what about red wine during immunotherapy? I think she means like also, can I have a glass of wine if I want to during treatment, but also is there benefit from drinking red wine because of, they talk about the phytonutrients and stuff like that.
Another great question. I always defer alcohol intake to the oncologist. Likely during treatment, it's not recommended.
Yeah.
Uh, and the American Institute for Cancer Research puts out these recommendations for cancer prevention, and they recommend that cancer survivors also follow these recommendations. And they're actually recommending not to consume alcohol, just because alcohol puts us at risk for other cancers as well.
Sure. And also, when you're looking at even at an immunotherapy treatment, one of the parameters that we use to check your response and tolerance to therapy are liver function. So if you are downing a glass or a bottle of wine the night before and your liver functions are high, we won't know how to interpret that in terms of treatment outcome necessarily. One of the other questions that has come across the chat is, Sarah had asked, I was wondering if you had any nutritional advice specific to melanoma patients on adjuvant therapy. So I know you don't do a lot with melanoma, so I don't want to put you totally on the spot with that, but she's talking about like the oral targeted therapy like BRAF and MEK inhibitors. Sometimes with that, we get a lot of diarrhea, nausea, vomiting. Are there interactions with the medications that sometimes can come up that you know of? Those kind of things.
So when you're having those types of issues on those types of therapies, I would recommend trying to do smaller, more frequent meals. So instead of your traditional 3 meals a day, getting in maybe 4, 5, 6 smaller meals if, nausea, vomiting, and bowel movement issues are limiting your intake. So not as to overwhelm you, but as to kind of make each little meal easier.
Sure.
And if you're having a lot of issues with nausea, work with the doctors to get that nausea under control. They'll typically get you some type of medicine that you can take maybe before so that the nausea subsides, so that you are able to eat and drink. And definitely focus on fluids during these times so that you're sipping some type of clear liquids throughout the day so that you are staying hydrated.
Sure. That's what I think people forget, that sometimes sitting down to a meal, like a breakfast, lunch, and dinner, can be so overwhelming when you just don't feel well. So grazing and snacking and just remembering just to take little bites of things, I think make a big impact over the day. And I
Uh,
think that gets forgotten sometimes.
yeah, I like to tell my patients that every bite and every sip counts. So um, trying to get in the small portions, and even if they're small portions and you can't quite get that in, every bite and every sip counts. So do your best and continue throughout the entire day.
Yeah. How about Bob wants to know post-treatment and when you have, survivorship, are there any changes in dietary recommendations, to help the immune system? Or are we just sticking to the same types of things that we want throughout treatment?
Great question. So for cancer survivors, it's recommended to follow more of a plant-based diet, limiting red meat to once a week, cutting out added sources of sugars, like sugar sweetened beverages like sodas, sweetened teas, things like that. And
Donuts.
they're actually my favorite food. Um, and maintaining a healthy weight. So
Yeah.
if it was tough and you lost a lot of weight, getting back to a healthy weight. And if you happen to be overweight, working with your team to get you to a healthy weight is really what's most important.
And Glenda also, as a follow-up to that, actually is asking, does BMI factor into, recurrences and having success in treatment and post-treatment success?
Absolutely. A lot of research does link higher BMIs to higher recurrence of cancers. Just because being overweight and being obese, our bodies are in a chronic state of inflammation.
Mhm.
Um, so working towards getting to a healthy weight and doing that in a healthful way is important. But again, doing that once treatment has completed and you're at a pace that you can do that. We don't want to see you lose a lot of weight during treatment because when we lose weight quickly, we tend to lose our muscle mass.
Sure.
So maintaining that during treatment and working on those weight loss goals afterwards.
Sure. That's really, really good advice. And I think, um, one of the take home messages is that, being slim and being overweight are both detriments to not only your overall health, but also your immune system. And so finding, a healthy balance of weight and diet and exercise, becomes important no matter if you're going through cancer or not,
Yeah.
I think. Do you have any, so an anonymous attendee submitted the question of sugar driving cancer, truth or myth. I think we kind of covered this. I think it's pretty clear that we don't think that sugar drives cancer. There's not really data, especially in solid tumor, that that's necessarily true. Um, and we talked about, you might have missed this in the beginning of our talk, but we did talk about how you need sugars in forms of whole foods, sugar, fruits, vegetables, whole grains to really help your immune system do what it's supposed to.
Mhm.
Um, do you have any specific advice or websites that you would say are okay for patients to go to read up? Because I know, we kind of push people towards the internet, unfortunately, subconsciously, and then they come back with things that
Yes.
they don't need to know.
Absolutely. So I've mentioned them a few times, American Institute for Cancer Research, AICR.org. They have a lot of good information about nutrition, about diet, about lifestyle. They have a lot of good recipes. So for those that are avid chefs at home, um, another good resource is the American Cancer Society, ACS.org or cancer.org. They also have a lot of good recipes. The Academy of Nutrition and Dietetics, that eatright.org, you'll find a lot of good information there as well. Um, and oncologynutrition.org, that is a subgroup of the Academy of Nutrition and Dietetics. There's a dietetics practice group that's just oncology nutrition, and that's their website, and they have some helpful tips there too.
That's really, really helpful. I'll eventually link these once we get off of here. I can't type and think at the same time. One of the other questions that came across the chat is about turmeric tea or turmeric tea. I never know how to say that word. Is that something that would be considered in the whole food group, since it's sort of a spice and not necessarily something you can consume outside of, putting it in your food or tea or whatever?
So I think that turmeric as a spice is totally fine, but if you're going out and you're buying turmeric capsules
Capsules.
and
Yeah.
use that to make your tea, I would say no. Um, but using it as a spice is tasty, but you also get some phytonutrients in there too.
Okay. And what other kinds of antioxidants would you recommend necessarily if someone was looking at like, you know, here are the things that I want to eat that are packed the most full of nutrients for my cancer, for cancer fighting things. Like what types of fruits and vegetables? Because I'm assuming that's where they're coming from.
Yep, they're coming from fruits and vegetables. And I'd like to tell you that you want to get a variety and kind of eat the rainbow. The more colors, the more variety that you're included, the more variety of these phytonutrients. Each color component of a fruit and vegetable is a different phytonutrient, essentially. So the more colors, the more variety, the better off you are.
And veggies first. Veggies more than the rest of things, but include all the things, right?
Include fruits and veggies. Yep, absolutely.
Um, just so I can say this out loud, there's no approved diet for oncology. There's no like, you should be eating this diet. This is the only thing that works. Because we get that question a lot. You know, people are like, what should I be doing? I heard I should be on this particular thing. And I just,
Yes, no particular diet. When I have patients, family members, caregivers come to me and say, I read about this diet online, I most likely know that they didn't get it from anywhere that's evidence based. Uh,
right.
so, no diet in particular. Eating healthfully is what I like to say.
Perfect. I wanted to just from my side tell there was somebody that asked a question about the specific clinical trials that suggest that immunotherapy is beneficial with the microbiome. And actually, if you contact the person that asked that question, I can't find it now. If you contact me on on the AIM at Melanoma, either through the form or on the phone, I can actually direct you towards those clinical trials because there are a few. There's one from the University of Pittsburgh, MD Anderson, the NCI. There's actually several studies, and these have been going on since like 2000 and I think 12 was the earliest one that I could read the whole article, but there are actual clinical trials with looking at a lot of retrospective data, a lot of like dietary journals that patients filled out and what they ate. And now within the last 2 years, there's this shift toward actually looking at the bacteria in the gut and how that impacts the response to immunotherapy and who are these people that, have complete responses to treatment and what did they eat and all of that. So I look for the future of where we go with treatment to really be very holistic and lots more nutrition based to try to help kind of harness that bacteria and getting those healthy things. But gosh, this has been the fastest. I looked at the clock and I was like, oh my goodness, 40 minutes have passed like this. I think if there are more questions that, come across, certainly I can forward them to you after the fact. This has been super helpful.
Oh, I'm glad. I'm so happy.
Yeah, I think make sure that everyone does talk to a nutritionist if they have that available. It's a great resource. Tara, any other, parting thoughts that you want to leave us with?
When in doubt, always ask your oncology team about anything. If they don't know the answer, maybe they don't have access to a dietitian, they'll guide you to where you'll get the accurate information. I just hate to see families and patients like scouring over not sound information from the internet because unfortunately anybody can post nutrition related information on the internet. And if you're looking for sources, look for somebody that is a registered dietitian, look for somebody that is a certified specialist in oncology nutrition to direct you and steer you in the right way.
That's really, really helpful. And again, that website to look for a specialist is eatright.org. I know Eric, our extraordinary host, has posted some of the other websites that you talked about. I think
Thank you.
Um, certainly there's lots of resources that are peer reviewed out there, and you are wonderful. And I hope that we can have you on again at some point to kind of talk through some more things. Thank you for taking your time outside of your work and life. Um, Everyone that's listening on Facebook and on this webinar, it will be available later. It's recorded so that we have a YouTube channel. You can watch it there. If you did register later, they send you the link to watch it later. So there's lots of ways that you can rewatch this. And if you have questions, certainly get to me on the website for AIM. There's multiple ways you can get a hold of me, and I'll get those questions to Tara. She can help me out on the back end. But thank you again for joining us. We're going to sign off here. And I hope everyone has a good night. We'll see you next month.